Hello, everyone. Welcome to Go Campus. Now, after the recent Canada announcement on express entry for doctors, we've had many doctors, that is, specialists and medical students reaching out regarding opportunities in Canada. And as we always say, it's best to hear from an expert already working in the healthcare system. And that's why we are here with this episode. So today, I'm pleased to welcome Dr. Karan Gupta. Dr. Karan completed his orthopedic surgery residency at the Postgraduate Institute of Medical Education and Research, that is PGIMER India, and is now practicing family medicine in Canada. So, in this episode, we will explore doctor's journey as an IMG, navigating the Canadian healthcare system, the challenges he encountered, and the insights he has for other international medical graduates considering opportunities to practice medicine in Canada. So, very warm welcome to you, doctor, and thank you so much for taking time to be with us here today.
Thank you. Thank you for having me.
Doctor, just for our audience to understand you a little better, can you please tell us a bit about your journey, where you trained, and what motivated you to move to Canada professionally?
Okay. Thank you so much for the question. Myself, Karan Gupta. So I basically belong to a small town named as Basi Patana. It's in a rural area of Punjab. I had been passionate about medical and being a doctor ever since I was studying in lower grade in my school. My father is a pharmacist, so that was my biggest motivation to go to medical school. I trained and did my MBBS from Government Medical College, Patiala. It's one of the oldest colleges in the northern part of India. And after that, I did my orthopedic surgery residency, MS Ortho, from PGIMER Chandigarh. It was quite competitive to get in PGI, as you know, it's one of the prestigious institutes of India, but it was one of the best experiences I could have had in India. It was a great learning experience over there. After my residency, I felt that I am ready to go into independent practice. And then I started working in closer to my hometown. It was Indus Hospital. And I worked there for about 18 months. And I did pretty much all the surgeries, like doing scopes. I did joint replacements, trauma, spine, as much as you can do as the orthopedic surgeon. Now, during that process, I was looking into other countries as well. And then I looked into Canada as one of the possible options. So I applied my permanent residency while I was doing my MS Ortho. And fortunately, I got the visa and I got the permission to be a permanent resident while I was in India. And I got my visa in 2022, I believe, and then I moved to Canada. That was my biggest step in my career. My biggest motivation to move to Canada was I was looking into the culture of healthcare in Canada. The biggest motivation was there is no hierarchy in practice in Canada. Like once you're done with your residency, you are an independent practicing doctor. You are at the same status and same level as somebody who's working there for like 30 years. So there is no hierarchy in Canada. Everybody treats you like a colleague. You get similar pay grade, similar, like you are respected as their colleague. So it's significantly better as compared to India. And job opportunities are like Canada is in need of doctors. They don't have doctors over here. So that is biggest change. So you are respected as a healthcare worker because it's a public funded system. Your patients come to you and you just have to do the process and see them and help them in the best way possible. So the culture is significantly different because it's public funded system. Patients pay through their taxes, and they don't pay even a penny out of their pockets when they come to the hospital. So it's very different as compared to India. So that was my biggest motivation, that I wanted to come here and explore and see if system fits better according to my interests. So that worked out fine.
Thank you so much for that, doctor. Now, I just want to know from you, because for all the MBBS doctors who are watching this podcast today, can you briefly tell them what are the key steps in the Canadian medical licensure process for IMGs? Maybe immediately after this question, we can cover, like, for specialists watching this podcast today, what are the key steps involved for them to start practicing medicine in Canada? So shall we go with what are the key steps involved for MBBS doctors first?
Yeah, I would say the biggest limiting factor would be getting the permanent residency, like the PR visa that we call. It's honestly not as difficult if you look into the requirements for it, because MBBS is counted as a master's program. So I would say get in early, try to apply PR visa. And while you are waiting for the process to be done, start preparing for MCCQE1. It's not a difficult exam. They only cover third and fourth year subjects. So prepare for that. And then the other exams are NAC OSCE and Casper, OET. And those exams are usually done when you come to Canada. So that's like further steps into it. And once you are done with these requirements, you just apply for your residency pathway in Canada.
Okay. So, doctor, for MBBS doctors, the only recommended pathway is the CARMS pathway, is it? That is where they try for this. Then, okay, thank you. And for specialists watching this podcast today, will you be able to briefly tell us what's the best recommended pathway for them if they're exploring Canada?
Yeah, so there are multiple pathways. Like they can go through the CARMS pathway as well. It's pretty easy because they do understand that if you come with an experience of an independent practicing doctor in some other country, they would respect you in a similar way, like a practicing surgeon or a doctor or a physician in Canada. So you can go through CARMS pathway, and it's relatively easier if you are a practicing specialist. So you will get in easier as compared to somebody who's coming just the MBBS. Secondly, there is another pathway to get the direct license, which goes through fellowship. Like there are few public funded fellowships in Canada. You can apply while you are working in India and then get into the system with the fellowship after that, because you would have required duration of kind of learning experience, and then you can go for the provisional license. So with the provisional license, what happens is you will get the privileges to practice, but it'll be for 2 to 3 years because you will be associated with a university, like a teaching institute, which is even good. Like you work with the system, we work with the team environment. So there are multiple opportunities with that provisional license. During that, you can do Royal College exams, which is similar like a exit exams in India. So after you are done with the Royal College exam, you have practiced for like 2 to 3 years with the provisional license, you will get the independent license, and then you can work anywhere, like anywhere in Canada. The good thing is with the provisional license, you will get similar salary, similar pay as somebody with the independent license gets. It's just that you are associated with a university during that process. So that's the only change. It's not difficult, and they are desperately looking for specialists. So yeah, that's not too difficult as well.
That's nice. Now, doctor, when you moved to Canada, I mean, you'd completed MS from India. So, what exams or certifications or which pathway did you take?
So for me, honestly, I did not have any information on what to do, which pathways are available, what to do while I was in India. So when I came in, I directly looked into the CARMS pathway. So I wanted to do the ortho residency or family medicine residency. And during that process, I got exposure for multiple universities all over Canada. And then I decided on going for family medicine. And that's the process that I followed for myself.
Okay, thank you. So, if I can just ask you a question here, doctor. Now, you trained as an orthopedic surgeon in India. So, when you moved to Canada, shifting into family medicine must have been a very different path. So, was it emotionally difficult for you, or was it something you chose consciously as part of your long term plan?
Yeah, I get asked about this question quite a lot. Honestly, it actually works around what you want. Like my goal of working as a doctor was to advocate for the community. In India, the culture is in such a way that there are specialists who take care of all the patients. But in Canada, what happens is every patient get to see a family doctor, and then a family doctor refers them to a specialist. So Canada needed a lot of family doctors, one thing. But coming to my ortho background, when I looked here, necessarily what happens is once you are working on a system, so you are kind of bound by the system. Like if you're working as a spine surgeon, you just see the spine patients. But I wanted, like my niche of practice was I wanted to do everything just as I was doing in India. So I wanted that flexibility to do a lot more. The good thing is with family medicine, I get to do sports medicine. So which is using the similar knowledge of my ortho background. So I get to use those skills. So that was my whole plan to go into family medicine. It's a shorter program, 2 years program, and then you're working as a sports physician in Canada. That was my plan. But yeah, it was well thought of plan because I didn't want to go through the 5 years of residency process again after that.
Okay, understood, doctor. So, doctor, we get to hear from a lot of doctors because I'm sure most of you watching this podcast today know that Go Campus assists doctors for UK, US, Australia, and now we've started Middle East. So we do support doctors to prepare, train for multiple countries licensing exams. So in this way, this is what we do every day, talking to different doctors, having different goals, different ambitions, different destinations. So most of them, when they speak to us, they say Canada is, though we are getting to hear that Canada is open express entry pathway for doctors, Canada is looking for doctors, all this, they still say Canada is one of the most toughest country to crack residency. It's highly competitive, and many doctors over there who've gone to Canada with a lot of dreams are currently working as drivers. There are no jobs. We get to hear a lot of things. Is this really true, or is this a myth, doctor? Will you be able to give us some highlights on this or kind of share some insights into it?
That's a fantastic question. So honestly, I think it's all about all the news that we get to see online. I would recommend you one thing, like if you're getting into and looking into opportunities around the world, I would say do your own research first, because that's what happened with me. I was believing what other people were mentioning about it. So that kind of created that negative environment at around what should I do, or if this is even worth trying for that. So I would say do your own research, collect the information as much as you can, and then go around it. So coming to the facts, you can quote me on it. I'm talking about what the data is online. So around the 2025 match process for the CARMS, you can look up online as well. There were 1770 applicants for all the residency pathways around Canada. Now, Canada has separate spots for IMGs, like international medical graduates.
Mm-hmm.
So eh, I don't know if you would believe it or not. Out of 1772 international applicants, 50 applicants matched. So that's like 48% success ratio. And you can compare any other country. US is less than 10%. Australia and UK process is a bit different. So 48% success ratio. So you will get in and you can go into like out of 850 spots, 450 were in family medicine, 70 were in internal medicine, 50 were in surgical specialties, and 150 were around other specialties that were available. And the success ratio for recent grads, which is 3 years within completing MBBS, was around 80% out of that 48%, I would say. So it's not bad, I would say. Coming to the other question, getting a job. When I came in, I was again in the similar turmoil. Oh, where should I work? What should I do? So it really depends on if you have the correct guidance, if you have the right information. I was jobless for 3 months, 4 months when I came to Canada as well, because I didn't know anything when I moved here. But then I got connected to people who had that information and who guided me. And then I went into medical research programs, and then I got to know about healthcare opportunities like Canada. Do recognize your experience while you're working and do recognize your MBBS as well. They will give you the license to practice as clinical assistant or as a surgical assistant or an associate physician. And I would say the starting salaries for them are minimum 1 lakh per year, which is not bad considering the cost of living, which is like really, really good as compared to other jobs that we have here. Plus, the benefits are that you are working with universities, you get letter of recommendations, which are again a requirement for Comms Pathway, and you get to make connections. You get to learn about culture of healthcare in Canada. So that looks really good on the CV, and it's not difficult. It's just that you need to know what you need to do about that. So I would say don't believe the information. It's relatively easier as compared to other countries, because I don't know other countries. I know about US, I know about Australia. Getting a job as a healthcare worker is a very difficult initially when you go there, but it's relatively easier in Canada.
True, doctor. I mean, that's what we even tell all the doctors who reach out to us, or because now we're going to start our AMC Australia training batch. That's what we advise all the doctors. Currently, I think all global opportunities, the competition level has raised quite steep. And in every country, there's one or the other plus and minus. In some countries, jobs are a little easy. In some countries, exams are a little easy. So we always tell our doctors, you just choose which pathway you want to choose, because every pathway is difficult. Just that where you want to put your effort, and hold on to the right mentor. Find the right mentor who can guide you, who can advise you, who can give you the right direction, who can tell you the right steps. It might take a time, but I think they'll be there as long as they're in the right direction. Now, typically, when we speak to whether it could be specialists or MBBS graduates, the first question that doctors ask is, of course, pay is very, very important. First, they would ask the remuneration, the cost of living over there, and all. The next question that doctors ask is, how's the work life balance kind? Because in India, they feel they miss that work life balance. Hence, most of the doctors do ask that what's the work life balance in a particular country? What is involved in this? So, I would like to know from you directly what's your typical workday like in a Canadian clinical setting? We would like you to speak on the working hours, the week off that you have, and the overall schedule. How does it work, doctor?
Thank you so much for asking this question. And this is one of the most important things that I want to talk about. That was the reason I decided to stay in Canada. So before, like after you are done with your licensing process, once you are an independent doctor, nobody is going to ask you that you have to work for fixed hours because you are an employee working with the public health system. So you get to choose your own hours. Now, the expectations are, if you can, try to work around 40 hours a week. That is like just 8 hours per day for 5 days a week. That is the expectations. But for me as well, I choose my own schedule. Like I work for 2 to 3 days. I work 12 hours for 3 days and then I'm off for 4 days. So you get your remuneration based on the hours that you are working and the patients that you are seeing. And this is such a big thing to talk about. Like in India, I was working for 6 days and for 10 hours. And remuneration wise, it is so much better. Like I would say, minimum numbers you can make after getting the license is anywhere north of 350 to $400,000 per year, and the cost of living is not too much. Like the median income that a Canadian family usually makes, and a family is 96,000 per year. But as a practicing physician, you yourself will be making more than that. So you will be eventually in top 1%, irrespective of how many years you work in Canadian healthcare setting. And the best thing I would like to mention about is a traveling doc opportunity. Like somebody like me who loves to travel, what I can do is I can sign a contract in a particular place for 3 months, and then I'm practicing there, working there for 3 to 4 days a week. And then for rest of the time, I'm just traveling, hanging around, engaging with the community. I go for hikes and I love to stargaze. So I look for those opportunities. And after 3 months, I would go to another place. I would sign a contract with them and I would work with them. And my travel is covered, my accommodation is covered, my licensing process is covered. So they necessarily pay for everything. And I'm traveling and I'm enjoying my life and I'm working at the same time and helping my community, fellow community members. So the flexibility that we get over here is significantly better than other areas that kind of have like other opportunities that we have as an MBBS graduate from India.
And Doctor, how has living in Canada been on a personal level? Let's say community, lifestyle, family life? Because I think many doctors do ask when they talk about other countries, is it safe? Is there racism? All these questions that they would ask us, like, how's the life here? Do you find a lot of Indians around? How strong is the community support?
Yeah, there's a saying that you will find an Indian in any corner of the world, which is true for Canada. Canada, they are like, I was in a small town, it was like 10,000 population, and still I had 300, 400 fellow Indian community members to hang out with and to talk with. And if we talk about bigger cities, I would say our Indian community is making up to 15 to 20% of any major city right now. They are the working members. I would say if we talk about racism, Canada is one of the most immigrant friendly countries in the world. They love to have people who are working hard and then they respect them. Coming into the lifestyle, again, we talked about the flexibility of healthcare practice over here. Working hours are not too crazy. You will get your Indian food. You won't miss anything at all. Coming to the Indian grocery as well and engaging with our fellow community members, you will celebrate all the festivals. You will get extra hours to spend your family because you are not working for crazy hours. So burnout is like, Canada is one of those countries where the burnout rate amongst physicians is the lowest amongst the first world countries. So that is something big to decide, especially like coming um, uh, from an area where the burnout rate is pretty high. So I would say like with family as well, there are no housemates here, so you can do household chores with your partner. Like that's what I do, and that's what the beauty of this country is about.
Thank you, Doctor. And Doctor, as we understand, whether it is US, UK, or Australia, the CV, that is portfolio, is very, very important. I think every country, when they apply for training jobs, they do get certain points for different domains and different achievements. In Canada, also, is it like this? Is CV or portfolio really important when they're applying for the residency match?
Yes, necessarily CV is one of the most important documents when you're looking into applying for residency for a job, because that's like what we call is that's your identity, as they say in Canada. That's your identity. That's what define you. So that's one of the important components which we usually look into, and getting the experiences is important, and presenting in a way that they want to look into is again an important component of CV. So I would say like full points and try to put all the efforts that we can for that.
And what are the important segments that they should cover? Like, what is it seen in the CV, Doctor? Is it research, publication, presentation, anything like anything that's very, very important to have in the CV?
It is very different from other countries. In Canada, they will appreciate all the experience that you have ever had. Like coming from education, if you have done any other degrees as well, we would like to show it to them because that's important. And then research projects, exams, all the certifications, conferences that we attended, presentations that we did, all the prizes, and all the recreational activities and hobbies are important as well, because again, that's important component of who we are, because that keeps us sane while we are practicing. So they give a big emphasis on that too. So it's important to show as much and everything as we can. And volunteer is another component, because then they would get to see how engaged you are with the communities and how appreciative you are of the community values. So that's another important thing that we would like to have on our CV.
Okay, that's nice. And Doctor, if I'm not wrong, so ideally in Canada, after they pass the part one of the exam, that is after they pass the MCCQE, they can apply for assistant doctor jobs and then slowly do their NAC exam. Is that right?
Yes, I would say do the MCCQE1 while you are in India. And when you come back here into Canada, you will get the job right away, because that's the only requirement. Get the Indian experience as well as much as you can. But when you come in, you'll get the job. During that time, you'll get to know how we deal with the patients and what things the way we deal with the patients, because OSCE exam is necessarily exam where you talk to the real patients, and then they would judge you how you are making them feel. So it's about the approach towards the patient that they usually judge during that exam. So that covers all other components when we practice in Canada after coming here with the MCCQE exam.
And just, I think, one last question before we close this. Doctors should have PR before they apply for jobs in Canada?
I would say yes. PR is one big component, because without PR, you won't even to apply for CARMS pathway. For job, you can get it with the work permit as well. If you have open or closed work permit, or open work permit, you will be able to get a job with that, but you won't be able to apply for CARMS.
Understood, Doctor. So, any final words of encouragement for doctors who are planning to move to Canada in the next 1 or 2 years? Like, do you have any final advice for them now before we close this session?
Yes, I would say do your fact check. Don't believe on what others say. Data shows things different as compared to what people have to say about it. I would say collect all the information, have the correct and right and positive approach on what your goal is. We at Go Campus are happy to help you in any way possible at all the major steps. I have been into the system. I'm happy to advocate for you in any step as we can. So it's just a matter of controlling the controllables, and the rest, everything will be good, because these countries, they support you at all the levels, and they want to have more physicians as much as they can. So once you are here, you will be appreciative of how things are done over here.
Thank you, Doctor. So,
Thank
this
you.
is for all the listeners. Now, if you wish to connect to Doctor one on one, let's say if Canada is on your mind, then I think you should book a one on one session with Dr. Karan Gupta. Now, to have a one on one session with him, you should go to gocampusworld.com, search for Dr. Karan, and book a one on one session with him. Now, for the first time on Go Campus World, because we are getting so many requests, because we can see everything online that Canada is wanting more doctors, Canada is falling short of doctors, Canada has announced express entry pathway. And understanding that NEET PG counseling is almost closing now, though they've just announced the revised eligible percentile yesterday, doctors are reaching out to us more now. Since yesterday evening, we can see many calls coming in where doctors are exploring what next now. Because NEET PG, they have a clarity. And some doctors feel that currently US is very competitive. UK jobs have become a little difficult. Australia AMC exams, many doctors say it's quite challenging. So if you're exploring what other options that I have, then we are launching an exclusive Canada group mentorship session with Dr. Karan. Very small batch size, not more than 10 to 15 doctors in this, because we generally don't do group mentorship session. But because we have many doctors reaching out to us, we've requested, doctors agreed for it. So whether you're an MBBS graduate or a specialist, or let's say we did have many doctors reaching out to us that have cleared USMLE, now I'm looking forward to Canada. What should I do? What are my next steps? So if Canada is on your mind, then don't miss this. Book your slot and be a part of this session. And for booking this group session, there's a different process. So you can reach out to us. You can see all the details in the description below. But if in case you want to have one-on-one session with doctor, that's already open on the platform. You can book a one-on-one session with doctor. Thank you so much. And thank you for your time, doctor. It was really very informative and very insightful. And I guess it was a very honest discussion. And this is coming from someone who's done masters from one of the top institutions of India, and doctor has gone there. And I think he's put across there very honestly how the opportunities are, what it is, how it is. So as doctor mentioned, you don't have to believe everything that's written online, because they all are many anonymous articles, because we get many doctors reaching out to us. I read this online. I read this online. Is this true? I think that's not correct. Doctor mentioned, if you want someone to listen to you and give you the right feedback, right guidance based on your requirement, your timelines, your necessities, your potential, then you have to speak. You have to speak to someone who's already in the healthcare system, get the best advice, and then decide if Canada is right for you. So thank you so much, Doctor. It was really very nice having you today with us on this podcast.
Thank you, Ashwini, for having me.
Thank you.